All right, so we're gonna take a look at a couple different things based on Marty's assessment of how we go through posture and stance for the golf club, right? Let's take a good posture right here. So if you're looking at Marty's stance, he's got a nice hinge at the hip, right? What we're talking about is being able to set back that pelvis back here. He's able to load that hip and put the pressure on there, so he's not putting a lot of pressure on the low back. He had talked about his upper back being kind of curved this way. He's worked on it over the years. You can tell that he's fighting it and kind of opening up, so he's allowing himself to be able to open the upper thoracic spine and the lumbar spine without putting pressure on that area. If you look, everything is nicely stacked on this. When you're seeing with patients, one of the things that we'll see is that this stance will break down. So let's go into a bad. So here, you can see that he's kind of shifted that hip forward. That puts a lot of extra pressure on the low back. If you're looking also too, his knees are a little bit more bent than he's used to. And so the pressure and the line of drive over his hip isn't there, and he's not distributing the weight evenly. And also if you look, he's kind of rounding over and leaning back. So can you turn facing the camera so you can get that tilt. He had talked about having all the weight right over the shaft, but he's kind of tilting to his right a little bit. And that's causing extra pressure that's happening in the lower back. One of the most common things we see with golfers is a lot of lower back stress. And if you start off with this bad position, it's already going to kind of lead you through your bad swings and injure that area. So we'll take a look at a couple different things based on how he actually swings. But this is one of the things that you can start with right away that'll help fix a lot of these issues.